let's say a person wants to work 40 hours during a week. Okay, well, one way to do it is to work 8 hours a day over 5 days. And many people have that conventional schedule, and it works for many people. So that there's also the possibility that a person might want to work on a compressed schedule so that they have a longer weekend, let's say, still working 40 hours a week, but instead of 8 hours a day, a person might work 10 hours a day for four working days, and still at the end of the day come out with having put in 40 hours of work. And our studies have shown that that kind of compressed schedule puts a lot of stress on people and increases the potential for not only acute injuries, but certainly also our study has shown for chronic diseases. What I found is that there is a threshold, and the threshold is that if a worker works, let's say, 8 hours a day, 10 hours a day, up to 12 hours a day, might be okay. But when you go over 12 hours per day, our research has indicated that there might be an increased risk of industrial injuries or chronic disease over that period of time. Furthermore, if a worker tends routinely to work long working weeks that extend not only 40 hours a week, but as much as 50 hours a week or 60 hours a week, and especially if it goes over 60 hours a week, our studies have indicated that there is an increased risk not only of industrial injuries, but also potentially chronic diseases. But if you just looked only at the men, then the men had no elevated risk of chronic disease over that 32-year period. However, the women had 3 times the risk of chronic disease over that 32-year period compared to men. And that was an astounding finding. And in the follow-up study, we tried to answer the question of why there was such a greatly elevated risk amongst women compared to men. And the number one reason that most people identified was just that women are burdened, especially over a 32-year period, but women are burdened with a greater need for covering other kinds of activities besides normal work activities. For instance, childbearing and child rearing and domestic responsibilities within the household. And so those are the obvious kinds of explanatory factors that might account for that finding of a much greater risk for women than men for chronic disease.